Most people hear knee arthritis and immediately try to protect the joint by moving less, saving stairs for good days, buying a brace, and hoping pain settles on its own. The problem is that avoiding load for too long can stiffen the joint, weaken the muscles that protect it, and make spikes of pain more likely. There's a smarter path: gentle, consistent loading, stronger support from the hips and thighs, and small daily choices that calm inflammation instead of feeding it. If you've been guarding every step or waiting for a new pill to fix the knee, today I'll show you 5 science-backed steps that help many people feel and move better without promising miracles or quick hacks. You'll hear simple explanations grounded in real clinical guidelines and peer-reviewed studies. This is educational content to help you talk with your healthcare professional. It doesn't replace a medical visit or personalized care. First, keep moving in the green zone. Think of your knee as a living tissue system that responds to the right dose of motion. The cartilage doesn't have its own blood supply. It depends on the ebb and flow of synovial fluid that happens when you gently bend and straighten the joint. That's why complete rest, beyond the first day or two of a big flare, often backfires. According to international osteoarthritis guidelines, regular, low-impact activity is a core treatment, not an optional extra. Walking, cycling, and pool work are all good choices. So are Tai Chi and light elliptical sessions. The trick is dosing. Use a simple traffic light. Keep pain during activity at or below a 4 out of 10 and aim to feel no worse the next day. If you do too much and the knee throbs later or swells the following morning, that was a yellow or red light. Pull the dose down a notch next time. A large body of trials shows that land-based exercise programs reduce knee pain and improve function compared with doing nothing, and the benefits are similar across many styles, as long as you stick with them. If you've been waiting for a totally pain-free day to start, that's the common mistake. Most people do better by starting small, 10 minutes of easy cycling, a short walk on flat ground, and building gradually across weeks. Next, make your quads and hips your built-in knee brace. When the quadriceps in the front of your thigh and the glute muscles around your hips are stronger, every step places less stressful load on the knee joint. Clinical guidelines for knee osteoarthritis consistently recommend strengthening as a first-line therapy, and not just any strengthening. Programs that combine quadriceps work with hip abductor and extensor training tend to help pain and function more than training one area alone. Start with simple, joint-friendly drills. Wall sit holds for 20 to 45 seconds. Sit to stands from a higher chair. Step-ups onto a low step. Mini squats in a comfortable range, and for the hips, bridges, and side-lying leg raises. 2 or 3 days per week is plenty. Give yourself rest days between. If a movement pinches, shorten the range or lower the step height. You can also use isometric holds, pressing without moving, for moments of pain relief. Many people find a mid-range wall sit calms symptoms in the short term. A common mistake is doing only cardio and skipping strength, or doing only machine leg extensions that irritate the front of the knee. Balance the program. 2 strength days that involve both quads and hips, plus several shorter green zone cardio sessions you enjoy enough to repeat. Now, adjust the loads your body is carrying, inside and out. The forces at your knee rise with body mass, and metabolic health influences pain sensitivity and inflammation. A major trial from Wake Forest University found that people with knee osteoarthritis who lost about 10% of their body weight through nutrition changes, and even more when combined with exercise, reported less pain and better function than those who did not. You don't need perfection or crash plans. Slow, sustainable progress matters. Many clinicians suggest a Mediterranean-style pattern rich in vegetables, legumes, whole grains, fish, olive oil, and nuts, with adequate protein, roughly 1.0 to 1.2 grams per kilogram of body weight per day if it fits your health profile, to support muscle maintenance. Sleep also deserves attention. Poor sleep can amplify pain signals and make flares last longer. If you're at risk for vitamin D deficiency, Your clinician may check levels. Replacing a deficiency can support musculoskeletal health, though it's not a standalone fix for arthritis. The common mistake here is chasing supplements while leaving the big levers, daily eating patterns, step counts, and sleep, unchanged. Before you buy another joint capsule, track a week of meals, aim for a small daily calorie gap if weight loss is appropriate for you, and protect your bedtime like an appointment. Then, tune the mechanics you use all day and add smart supports, tools that reduce painful stress without making you dependent. Footwear matters. Shoes with good cushioning and, for many, a mild rocker bottom design can make walking and stairs friendlier to arthritic knees. Some people benefit from patellar taping or a light sleeve for short bouts. Others find an unloader brace helpful if arthritis is clearly on one side of the knee, though braces are usually a complement, not the main show. If you're limping, a cane in the hand opposite the painful knee can cut joint load and help you move better temporarily. Yes, opposite side. It shifts forces more effectively. At home, raise low chairs, add a rail where you climb steps, and fix the lighting and floor clutter that make you guard each step. On stairs, try up with the good, down with the sore, in flares, or use the handrail and go one step at a time. Program your workday too. Stand for a few minutes each hour, then sit. Vary positions so you're not locked into one angle that stiffens the knee. The common mistake is refusing a cane or handrail to stay strong, only to move with a painful hitch for weeks. Use supports as bridges while you build the strength and control that carry you long-term. Finally, plan for flares so they don't derail your progress. Everyone with knee osteoarthritis has bumpier days. Pacing beats the boom and bust trap. Instead of doing everything on a good day and paying for it, spread tasks across the week and take brief movement snacks that keep the joint from locking up. For stiffness, gentle heat can help you start the day. For a sharp, activity-related flare, a short cold pack session may calm things. Many guidelines recommend topical non-steroidal anti-inflammatories, gels you put on the skin, as a first medication option for knee OA, because they can reduce pain with lower systemic exposure than pills. If you and your clinician consider injections, be aware that cortisone can relieve pain for the short term, but isn't a cure. Hyaluronic acid has mixed evidence, and platelet-rich plasma results are still evolving with variable protocols. The point isn't to memorize every option, it's to have a plan you can actually use. Know your green zone activities, your go-to strength moves, your pacing rules, and your medication or modality choices agreed upon with your clinician. The common mistake is waiting for pain to be gone before you restart movement. Most people do better using the traffic light rules to resume light activity while the flare is settling. Let's make this practical. For the next 7 days, keep a tiny knee diary. Each morning, jot down how many minutes you feel stiff after waking, what the pain is at rest and with walking, and whether there's any swelling. Do one green zone cardio session, 10 to 15 minutes of easy cycling, brisk but comfortable walking or pool movement on at least 5 days. Do 2 strength sessions with 3 exercises, wall sit holds, sit to stands from a higher chair, and bridges or side-lying leg raises. Keep each session short, about 10 minutes, and stop sets if your pain climbs past a 4 out of 10 or if the knee feels more swollen later that day. Wear your most supportive shoes, use the handrail on stairs, and if you're limping, practice using a cane on the opposite side for outdoor walks until your gait evens out again. If you're tempted to avoid all stairs, remember, the goal is not zero load, it's the right load. Try taking stairs slowly with a rail, focusing on control, not speed. If your knee objects to deep knee bends, work in a shorter range and build strength where it's most comfortable. Depth can come later. If chair heights at home trap you in a painful angle, add firm cushions to bring the seat up a few centimeters. You'll stand with less stress and more control. If a day gets away from you and pain creeps up, don't punish yourself. Switch to heat for stiffness or a short cold pack for a sharp flare. Dial back the next session's dose and keep your streak alive with 5 minutes of gentle motion. You might hear that imaging tells the whole story, but many people with severe X-ray changes feel okay. while others with mild findings hurt a lot. Pain is influenced by many factors: joint changes, muscle strength, mechanics, sleep, stress, and even how confident you feel moving. That's why the most effective plans are multi-ingredient. According to widely used guidelines, education, exercise, and, when relevant, weight management sit at the center. Medications and procedures can help, but they work best alongside the habits you own. Here's your quick action plan. First, log it. Pain now, stiffness minutes after waking, what helps and what makes it worse. Data turns guesswork into precision. Second, start your 10-minute routine today. 5 to 8 minutes of green zone cardio plus 2 simple strength moves, small, repeatable beats, heroic and rare. Third, bring your 7-day log to your clinician and ask, where should I adjust the dose? Which 2 exercises should I progress next? You'll leave with clarity instead of fear. To recap, move in the green zone instead of waiting for perfect days. Build quads and hips so every step loads the knee less. Adjust the loads your body carries by nudging nutrition, sleep, and daily activity in the right direction. Tune mechanics and use smart supports as bridges, not crutches. Plan for flares so they bend your week, not break it. None of this guarantees a cure, but early, steady action may mean more stairs you can climb, more walks you can take, and more moments you can enjoy with the people you love. If this helped, drop a comment with your biggest knee arthritis challenge, stairs, squats, or long walks, and which 2 changes you'll make this week. Share this with someone who's pulled back from activity because of knee pain, and subscribe for the upcoming videos on hip strength progressions, balance drills, and a 10-minute anti-flare routine you can do at home. Information guides good decisions. Don't stop prescribed medications or delay necessary care. Talk with your doctor, especially if pain is rapidly worsening. The knee swells dramatically, you can't bear weight, you develop fever, the joint locks or gives way, or you're simply not improving with a reasonable trial of exercise and supports.